Hello and welcome to this segment of Calf Management Tips, brought to you by Milk Specialties Global. I'm Elizabeth, calf specialist for the team, and today we're going to cover how to administer subcutaneous fluids. It's appropriate to administer subcutaneous fluids if the calf is somewhere between 5 and 8% dehydrated. Anything less than 5% oral rehydration is appropriate, and anything over 8% intravenous rehydration would be more appropriate. So if you're not sure of how to determine the level of dehydration in a calf, you can review our calf management tip video on evaluating dehydration. Supplies needed to administer subcutaneous fluids are a 16 gauge by 1 inch needle, an IV line set, and a bag of sub-Q fluids. Today we're choosing to use saline, but it's important to note that not all fluids are okay to administer subcutaneous, and not all fluids are okay to administer intravenous. It is important to consult your veterinarian to determine which fluids would be appropriate for you and your form of use. The first step in administering the subcutaneous fluids is to immobilize the calf to the best of your ability. I like to do this by backing them in a corner and securing their head and neck with my thighs. You can uncap your needle, make a tent with the skin, and place the needle gently into the skin, being careful not to administer it into the muscle. You know you're not in the muscle if you're still able to freely move the needle and it's not held taut. You may then uncrimp the fluids, elevate the bag, and allow them to flow into the calf. It is also important to note that you do not want to administer more than 200 cc's per injection site. When you pull the needle, you simply pinch the skin where the needle was in to avoid leaking. Some fluid will leak out of the skin as you move on. You can administer along the neck and along the rib cage to get the appropriate amount of fluid into the calf. We hope you've enjoyed this session of Calf Management Tips. Have a great day.